All right, everybody, I'm going to call to order this meeting of the Dunn County Health and Human Services Board for Thursday, March 23rd. Let the record show that all members are present, save Supervisor Robinson. She did. Oh, all right. Welcome, Hillary. Let the record show that all members are present. And Carrie Anderson from the Department of Human Services is here with us tonight, and welcome. And Cassie as well, and our county manager, and Supervisor Mike Kinnear and his spouse Becky Kinnear here to observe. So we need approval of the meeting minutes for February 23rd. I also sent the meetings from our abbreviated meeting on March 1st, but they're not on the agenda. So we'll just approve the minutes from the 23rd. Is that a motion?
Yes, I so moved.
Supervisor Steen moves. Is there a second? Supervisor Hagan seconds. Is there any discussion? Any additions or corrections to the minutes? No additions or corrections? If not, all in favor, say aye.
Aye.
Aye. The minutes from February 23rd are approved. Do we have any public comment? No. All right, we have no public comment. So moving on, our next meeting is going to be April 27th. That's a regular meeting date. Is that a problem again for anybody? Maybe it will be spring. Maybe it will be spring.
Wishful thinking.
Yeah, I know. Let's hope. Let's hope. The next item is to appreciate Bonnie Barker, who is participating in her last Health and Human Services Board meeting. She has been on the Health and Human Services Board for 6 years. She has been really, doesn't it seem that long? No. Well, you've been a fabulous member. We value your comments and your participation, and we're going to miss you. And we have brought you a small token of our appreciation. And we're also having a cupcake celebration. The cupcakes are available. And I'm sure everybody on the board joins me in thanking Ms. Barker for her contributions, and we will miss you.
Thank you. I'll miss you guys too, but I just can't believe tulips. We should be seeing tulips in our yard.
They're covered in snow.
Not for a bit yet.
I know.
Covered in snow. Mr. Quinn, you are next up on the agenda. Are you ready?
I am. Thank you.
I'm sorry you're missing the cupcakes.
That's all right. I just need to make sure my computer doesn't restart here in the next 15 minutes. Okay, good evening, everyone. Sorry for the inconvenience that I'm doing this remote, but I appreciate the flexibility.
It's fine.
I will start the report off with the memorandum report, which is a little light, but there's significant information. The first in discussion about the local. Can you hear me okay?
Yeah, you just were fading out a little bit.
Okay, I'm sorry. I'll try to speak up a little bit more. Looking at the memorandum document, the first thing locally, it's kind of a two-part. I included for your viewing the assistance that we received to get some media attention surrounding the most recent bill that was passed called the PACT Act, and it was, from my perspective, is pretty well received if I'm monitoring it based upon the number of phone calls and the inquiries and the discussions, and that's absolutely what we were hoping it would trigger. So that's a good thing that we're getting additional inquiries into that, how that new PACT Act may affect some of our local veterans and their dependents. So the another result from that is contacted by local news station to do a 2 to couple minute interview just to highlight some of the things about the PACT Act. And really the true message will be just contact your local service officers and get the updated information and learn about the expectations for support and assistance through that process. And so that'll be conducted, scheduled for April 4th. And thankfully to Mr. Mel, who's contracted through the county, did a great job in the write-up from my perspective and kind of getting this information out there. So hope to use him again in the future to get information out. Is there any questions regarding that?
Any questions for Greg? Go ahead, Greg.
I'll move to the next item, which again is only a couple sentences, but it's a major impact for our local veterans in the office. We did get the contract and check for the County Veteran Service Officer supplemental grant. That grant will go through the end of 2024. The total amount to be used, and it's there's not much restrictions on it, but our restriction as far as when we're going to build the budget will be for outreach and support to potentially increase the hours we have for our part-time position at 8 hours to enhance that over that now about a year and 3/4 time frame. And so the next step is just getting the check deposited and budget adjustment and get the cost allocation built, working with human resources. So that to me is some exciting stuff coming here in the near future.
Right.
And so that, yeah, and in discussion regarding on the federal benefits side, the PACT Act, again, there has been a sharp increase in inquiries, exactly what I would hope and expect from more media attention that is going out regarding that. And then on the additional financial side, I have the budget, the 2023 budget attached, and I'll speak to that here once this is done. And we've got our new position onboarded, and everything went well. And a big thanks to Human Resources Department and facilities staff to help make that go smooth. If there's no questions, I'll jump into the budget. Have attached with on that financial side, again, utilizing the new tool, the county, to make sure we're all speaking somewhat the same language. And again, our office's budget is not that robust and pretty easy to dive in. Just surrounding our salary and fringe, everything is on track. We project no concerns as we go forward. Operating expenses, we have very limited operating expenses, which we don't need. Again, in a small office, we don't use many products, and so do not anticipate any challenges going forward here 2-3 months into the budget cycle. Speaking to our cost center that provides veterans relief, we haven't got limited spending in that area up to this point. We do have a couple assistance requests that are in, and we've approved one for a veteran. And how we approach that, just for the human services information and those listening, is we view that tax levy money as the funding of last resort. There's many other resources that exist to help support veterans federally, some federal grants, state available funds. And so we try to tap into those resources first. When those resources have potentially used up all of their ability to assist that veteran in need, then we'll step in and then approve that. It's not a lengthy process. It's, a couple of emails, a couple of phone calls to find out what they're able to do. And so we have a couple of those in process right now. And then the last cost center is our County Veteran Service Officer grant, which is at $11,000. And at this point, limited funds have been spent out of that. We use that probably about 30 to 40% salary, and then for training materials, outreach materials, and we will get the additional budget bill to be brought forward for our April board meeting for an action item to get that approved.
Good.
Any questions regarding the budget?
Any questions for Greg on the budget? New budget document? Okay, go ahead, Greg.
I'll move to the next item that includes our activities for the month of February. I included one impact statement on there, and this is due to the newest legislation. And I was reviewing it before our meeting, and I realized I'd missed a word in there. But to speak to it, we will approach a claim for any veteran or dependent if there is logic and rationale that is centered in medical literature or other evidence through our research and through their statements. And so in this situation, because there was sound medical literature back in 2015 when decided to put this claim in, the surviving spouse who is the claimant, and she had lost her husband, who was a Vietnam veteran and was exposed to Agent Orange, and on his death certificate did list hypertension. And through the years, we've known that there's been plenty of research that has supported that conclusion. And it wasn't until August of 2022 that Congress finally agreed with the longstanding literature. And so since we put this claim in back in 2015, and it went through the appeals process, and we do set the expectations to let the individuals or the claimants know that it's going to be a tough one. There is a chance, in the absence of a private medical opinion, we have to rely upon a good exam or them to execute what's called liberalizing law to benefit in this case, the surviving spouse. So long story short, we just had to revisit the claim now that the PACT Act had been approved. And since we had applied for this in 2015, they have a responsibility to go back to the date of the claim rather than the date of the approval by Congress, because hypertension was listed. The result for the surviving spouse, because her benefits would have been, roughly around through the years, the cost of living ranging from $1,300 up to the current monthly benefit of $1,500 a month. But you quantify that over those years, going back to 2015, it creates some tears for a surviving spouse to know that it was finally validated. So very pleased with that. And then I listed a whole bunch of other benefits that have been applied for, that she'll be approved for, an additional health insurance and just that validation. And the hypertension, if on death certificates, they'll have primary, secondary, tertiary, and other conditions. And I actually contacted our medical examiner to thank her because of their attention to detail in listing out significant medical conditions for the death of this veteran. That's why this got done, because in this case, hypertension was listed as a contributing factor for the cause of his death. He had died from another condition that was not recognized. So that's kind of an educational long description of how this happened, and we anticipate having some more surrounding this, that same logic.
Greg, may I ask a question about this one?
Yes.
Was the result pending for 8 years, or was this a resubmission of the claim?
It was a resubmission, reopening of a previously denied claim. You need new and material evidence to do that, and the new and material evidence was Congress's approval of the PACT Act.
So it hadn't just been languishing for 8 years, which was my thought when I read this.
No, we had, went through all of our available appeal options outside of taking it to the Court of Appeals for veterans claims.
Okay, thank you.
If there's no additional questions regarding that, I also did include just a list of a number of veterans related bills that are being considered and led by Senator Tester from Montana. And so, and within there, one of them has gotten some traction, and it's called the CDSO Act. And I've briefed a little bit on that in the past. It potentially will offer up some federal funds to expand outreach, and there's no better time than now because there are parts of our country that do not have that direct county representation. They have to travel to potentially a veterans regional office or Veterans Administration regional office to get the assistance that they need or attempt it themselves. Pending any questions, that'll conclude my information this evening.
Okay, are there any additional questions for Greg? Supervisor Steen, please?
Yeah, Greg, I got a veteran over there that's a Vietnam Navy vet. He spent 2 years off the coast of Vietnam, and of course he was denied everything. But I think there's been some changes, and I've told him over the years, I told him to come down and look into that, because I think, if I'm understanding what you've told me in the past, and they were close enough to see the shore the whole time that he was there. So I think he might qualify for something. So I'm trying to get him to come down.
Tell them we have coffee in the office. Sometimes that works.
Okay, all right.
We'll bring some cupcakes.
Yeah, and Gary, I appreciate that. You've done that numerous times, and it's always best to provide that education so individuals can hear it from the office of the department that should have the up-to-date information. And you're right. If you can see the coast, that would mean you would have been within 12 nautical miles. And then it's just getting that substantiated for that Agent Orange exposure.
Yeah, I try to urge him to go down. I said, I got no idea what you're eligible for, but they've changed their parameters numerous times since Vietnam. So go and check.
Yeah, absolutely.
Thank you.
Anything else for Greg? If not, Greg, thank you. A good report, and thank you for keeping us apprised of the federal legislation and other kind of ongoing things. Thank you very much. We are moving on. Next item is public health report. KT, it's in your court.
Wonderful. Thank you, guys. So in your packet, you do have an update from the health department, short and sweet. I do want to kind of lift up 2 client successes that are shared in the packet. One, so our WIC office will oftentimes do for in-person visits, both screening for iron and screening for lead. One is good, one is bad. Unfortunately, with the waiver of families not needing to come in, while it's really beneficial for families to get their benefits, it has decreased our ability to do those physical tests. And so one of the client successes that you'll see in the update is that we had a family really struggling to do some follow-up testing about their iron levels for the child. Ended up working with our WIC manager, got the family in, was able to complete the test. The child was low, and they were able to connect them to care following that. So that was a really great way that we can support our families in an atypical way. And then we've had some recent, I think, high-profile layoffs in the region. And so we do provide services to help folks navigate setting up services through a grant that we received called MA Overmatch. So getting people signed up for Badger Care and other benefits. And so we had a couple folks come in following some layoffs, and we're able to sit down with Caitlin and navigate that process, because even as a literate, well-educated adult, navigating those systems are hard. And so it's nice to have somebody there with you to kind of banter back and forth and walk through the process together. And so those are two client successes that I wanted to lift up that are in the updates. One quick thing that's actually not on the update, but I wanted to share, it just came to fruition. The county manager in Chippewa County reached out to our county manager and asked for some support from the health department. Their health officer is taking a position in Eau Claire as their human services director. So that creates a vacancy. So in the interim, they have asked the Dunn County Health Department to support with interim health officer duties. And so there is an MOU that was taken care of, I think, yesterday, and it has been finalized and shared with staff. So that is an MOU for 90 days. Chippewa County is really aggressively recruiting. They hope to have their interviews done by the first week of April and have someone in hand fairly quickly. So I don't anticipate it'll be a significant impact to my team, but it is something that we want to extend them that support so that if there is a need in the health department or some other department, they'll extend the support to us as we have. And then I think that that's all the information I wanted to share out of the report. We
Picture, by the way, of the baby.
the little, oh, I remember those days.
So do I.
Eating pesto.
Looks a lot like peas, doesn't it? Yeah.
They wear it.
Supervisor Steen has a question.
Yes, KT, this memorandum of understanding, are we gonna send a person over there full-time for this time, or how is that gonna be
No,
handled?
sir. So it's my time.
Oh, it's your
By
time.
statute, you do need to have a qualified health officer that meets the statutory requirement, which is a
Alright.
master's degree for a level 3 health department or 16 graduate school credits. And so I'm available or will be available after their health officer leaves, which is the 20th of April, for about 5 to 10 hours a week, really to help them and coach them through some of those higher level concerns that they may have, be available to the state if they're not that
Sure.
we're asking for any kind of knock on all the things.
Right.
But if there's an outbreak or some type of environmental exposure that would require either activation of ICS or incident command or some type of liaison with the state. So, you know, everything from high path avian influenza or a large foodborne outbreak or some kind of chemical spill. Oftentimes there is that liaison with a local health department through the health officer.
And can I ask, please, KT, what is an transient non-community audit with the DNR? I mean, obviously it
Yeah.
has something to do with water.
It does have something to do with water. So in your packet next month, you'll actually get the write-up on our transient non-community water system. So a TNC well, it's well water that services a certain amount of people for a certain amount of time. So it's not a community water system. So it's not everybody for all days. It's some people for some days. And so those are things like churches, libraries, bars, that kind of thing. And they're required to be licensed and they're required to be audited. So we are delegated from the state. Our environmental health folks are delegated. And we do complete that program. So as part of our delegation, they come in annually to review our program to make sure that we're meeting the criteria. They've been really helpful in the past. So when we had the staffing lapse, they actually came in and helped us side by side to complete some of those audits to make sure that the drinking water was safe in those establishments. And we have a really good working relationship with the DNR on this program.
And is this something that you do, the health department does in partnership with environmental services here in the county? No.
No,
Okay.
no.
Right.
It is oftentimes, many of them are also regulated through our DATCAP programming. So we're able to do a restaurant inspection or something along those lines, and then also pick up a water sample and walk through their water system to make sure it's in good working order.
Thank you. Supervisor Steen.
Yeah, where would campgrounds fit in here, or is that a different category altogether?
So it could be that they are a TNC depending on how many days they're operating and how many campgrounds they have. We do have campgrounds that are a TN for us or TNC. but not always. But they are also regulated through debt cap, depending on the size. And so we've had lots of conversations recently with a couple different campgrounds that are either looking to start up or look to come into compliance and be licensed.
Other questions? Yes, Supervisor Breslin.
Yes, this is a yearly audit. Our DAT cap audits, we do self audits and then have an in-person audit every 3 years. And now we have just started our DSPS for our body art program as an annual audit as well.
Any other questions for KT on the program update? Go ahead, please, KT.
I also included in your packet the Wisconsin Epi Express. So that's something that the state puts forward about different communicable diseases. And then my apologies, and I can share it if you would like to see it, but the normal PNG kind of long banner that I normally include did get truncated. Let me see if I can just share my screen really quickly. Oops, it's disabled. Are you able to do that from there?
The participants on the bottom, Carrie. And then up there on the top where it shows KT. Oh, KT.
There she is on the bottom.
You should be able to make her a co-host.
Thanks everybody for working together.
Well done.
Well done. All right, so just sharing my screen. There we are. So this should look familiar. You get this in your packet. I think what made it into the packet was sideways and about from here to here. So not necessarily the full thrust of what I was trying to communicate. I think what's really important to see is that we are seeing and continue to enjoy a reduction in our RSV rates. That's really helpful. And then influenza has gone way down. And hopefully we will not see a second peak. We have had 6 influenza associated hospitalizations this year, but if you think about that over long-term trends, that's pretty low for us. And when you hold that up against COVID, it's hardly anything. So really good information all the way around. We do continue to see strep infections. We have a percent positivity of about 1/3, which is still really high. But we're not seeing the invasive strep that everybody was talking about before. Any questions on this? Okay. Thank you for that. And then lastly, in your packet, I think we got to financials.
Good.
Okay, so what you see in our financials, you have both end of year and what's considered January. So because of how our meetings fall, you only see 1 full month of financials. So that's not a really good picture for your oversight responsibilities. That happens because we get updates literally the day after we submit our packet. And so that would have at least had January and February. But then the other issue is that when we bill, it takes a month to bill and then another month to receive the funds. So what you're really seeing is just the expenses that we know that we're going to have. Do know that I am watching the back end of these things very closely. We've actually made some adjustments to a couple of our grants. We've received a no-cost extension to one of our Title X funding streams. And we're not necessarily going to pay that out or use that out. And so we were able to purchase a couple tablets so that people can start to do their forms in the office instead of on paper. And so we're working through that process right now. And then also watching our workforce development grant, that is a multi-year grant. We've also received an extension on that one. And we're looking. So one of the things we were doing to spend that out was to have dual payment for the reproductive health nurse that's coming in, as well as Jeannie, whose last day is the 31st after 25 years with the county.
Wow.
And because our new reproductive health nurse is enjoying her first 10 weeks at home with a new baby, we're not spending that money the way we expected. So I am touching those budgets on the backside very, very often and making decisions in real time. So even though you're not seeing something that helps you see those changes being made, please know that they're happening, and you will eventually start to see them when you see more of the monthly adjustments.
I was going to ask if there were members of the board who were concerned about this. I mean, it affects all three of our departments, that date that the
Yeah.
packet is due and the finance lag. I mean, we could change the meeting date, but are people concerned about the lateness, if you will, of this information? Supervisor Steen?
Yes, Madam Chairman. So basically, all of our departments are 2 months behind.
A month.
Yeah, well, a month, but if you wanted to change the meeting date, that would be fine with me, but as long as we know, that that's the deal. you
Yeah,
know,
and changing the meeting date doesn't, it
Doesn't
doesn't
change
really
anything,
help.
except you're still a month behind, so.
yeah.
So no, from my point of view, it took me a while to understand the human services end of it, but that's how it is.
Yeah, and please feel free to be asking questions about finances because that's our job. Yes, Cassie. Yes, please.
The date of the tax due that Wednesday. Could we push that a couple days and still get it out? I mean, that's an option as well.
So that the packet goes out a full week before our meeting. Supervisor Steen?
Yeah, it really doesn't matter to me, and I don't want to make it harder for them than their normal working situation. Although KT and Cassie, what I'm interested in is we always ask the best case guess that we can have. Are we in the black or in the red? And that's helpful because way in the past, we've got ambushed a couple times, and I'm not looking forward to that happening again.
Dr. Hall, did you have a question?
So I was just wondering, so maybe if you get the financial report on a Thursday, is that right? So, but I also wouldn't want to put folks in the position of, okay, now you have to get all that information from the financial report into something that's ready for a packet, like say on the Friday. Like, I mean, I really like having advanced time to look through the packet because I'm a dork and I spend time looking at everything, but,
I hope we all do, but
well, yes, but so Friday would work just as well as Wednesday for me. I seriously am not looking at it before the weekend, but I don't know if that's realistic to say that then you would then have the opportunity to incorporate that financial information into the packet. Just a question for
I
you.
think we
KT,
could
go
make
ahead.
a very good faith effort to have that for you by that Friday.
Cassie, is that,
So Wednesdays are just what I was.
Right.
well, if that gives us more up-to-date information, that would be helpful. And particularly with this, since this is essentially our whole job. So, okay, Supervisor Steen, you had another question?
I was just gonna say, I'd leave it up to KT and you to do whatever's best for the department,
Okay,
Thank you for that feedback.
all right. Anything that you want to highlight in the finances?
No, I already did, just kind of speaking through workforce development and how we've had to change that. And then to give you guys some updates on the telehealth portion of Title X funding.
All right, thank you. Good report. Excellent. And we move on to the Department of Human Services, and Carrie Anderson is here. And she's going to share some data with us. Push your microphone, yeah. Okay, there you are.
All right, I'm on, yay. Paula is on vacation this week, so she just asked me to mention a couple different things as I was gonna be here to give a little speech on youth justice tonight,
Yes,
so.
absolutely.
she had sent out her staff report,
Mhm.
which I believe is included in all of your packets.
Yes,
So
it was
she
in the packet.
just asked me to report back to her if anybody had any questions about anything that was in her packet.
Are there any questions about Paula's written report? Hearing none, move ahead, Carrie.
Okay. In regards to the financial report, Human Services basically experiences the same things that KT experiences
Yep.
as far as, being on top of our finances. So it's
Not
just-
to mention that your finances are so complicated.
right, right,
Right.
especially with SAP, they just really are complicated. So just too early in the year to give any projections, but again, if you have any concerns, please feel free to give those to me and I can report back to Paula
Okay.
on those.
Yeah, Dr. Hall.
Yes. So, and maybe it's just because it's too early in the year and maybe you use year to date to then figure out what the projected is. But so on this report, there's a significant projected shortfall in terms of revenue compared to the budget that was adopted. So I'm guessing my question is, I don't understand how the projected is necessarily calculated. Like, is it just saying if we keep everything that we have this month and multiply it times 12, what's that going to be? Or
pretty
is
much.
it, okay, so it's not, we know this grant is coming and we're counting on it and including it. No, it's just based off this month. Okay, that's helpful. Thank you.
Okay. Any other questions on the finances? Okay, Carrie, go ahead, please.
Okay, I'm pretty sure that's all I had for Paula's information. So if you want to bring up.
Mm-mm. Okay.
Is this sharing though to the folks on Zoom? Probably not. No,
So Mr. Lamb can't see this?
that's what I'm wondering. Share screen.
That's it. And then share.
Wow, look at us.
There you go.
Well done again, twice.
Bill, can you see that okay? Okay.
Yeah, that's a
Good deal.
yes.
So my name is Carrie Anderson and I have been with the county 23, almost 24 years. I spent 15 of those years in child protection, doing the initial assessments for child abuse and neglect. And then the last 8+ years or so, I became a manager, and part of my management duties is youth justice. So when I worked in the area of child protection, I came from child protection is very much governed in state statute and hundreds upon hundreds of pages of Wisconsin standards. So they tell you within 3 days you do this, within 5 days you do this, within 72 hours you need to do this, and it's very, very scripted. And then I went over to the world of youth justice and things were not scripted at all. No standards, not one. We had statute, but no standards. So within the last couple of years, the state has really put a lot of work into coming up with some standards, coming up with a congruent way for counties to work, because our 72 counties in the state of Wisconsin were operating youth justice 72 different ways. So if your child, God forbid, committed a delinquent act and had to go to Dunn County, you might be treated in a very different way than if you lived in St. Croix County. So I just wanted to just educate everybody a little bit on some of the exciting changes that we have seen in the state in regards to youth justice. So youth justice This is something. Youth justice is basically, it's all of delinquency. So delinquency means if a youth 16 or under goes out and commits some type of crime, instead of being referred to the district attorney's office for that crime, like if you were an adult and an adult committed a criminal act, you would go to the district attorney's office. If you are a youth and you commit a crime, you get sent to juvenile intake, which is part of what we do. So we get those are called delinquency referrals. We get truancy referrals. And then we do all of the ongoing case management for those youth that are on court orders and deferred prosecution agreements. And we also have truancy court here in Dunn County, which is a pretty unique court, and not a lot of counties in the state of Wisconsin do have a truancy court, but we do, and we really like it. So the staff, youth justice staff consists of myself, and then we have Tracy Erickson, who's our juvenile court intake worker, which means all of those truancy referrals and delinquency referrals go to her. And then we have ongoing workers, Jenna Ginter, Markella, Sarah, Angie, and we have a social service aide, Clint, who does a lot of our mentoring, specifically with those youth boys. He does we have our own, we monitor our own electronic monitoring. We have our own electronic monitoring system, and he's in charge of that as well. So one of the first things that the state did was they chose a screening instrument that was to be used by all counties. So this screening instrument, the YASI, it's called Youth Assessment Screening Instrument, is evidence-based and measures the risk of reoffense as well as the youth strengths. So all of the counties are now trained in the YASI. So basically what it is it measures a youth level of risk, needs, responsivity, factors, and strengths to guide early decision-making and assignment of case resources, as well as assist in the development of targeted case plans. It looks to identify risk factors of youth to help professionals manage their caseloads and better structure and target services to youth with higher needs. So basically the premise there is that we don't want to be bringing youth who are showing up on the YASI as low risk. We don't want to be bringing them into the juvenile justice system. Research shows that that is more harmful, and we're doing them a disservice by bringing them into the system. And we should be connecting those youth with community resources, and we should be staying out, and we should be focusing our energy and our resources on those youth that are coming back as being high risk. So it's an instrument just specifically designed for youth. 10 domains were selected for assessment based on many years of research and the predictors of delinquent behavior. The YASI focuses on the factors that are most critical to promoting positive outcomes for youth. The information collected during assessment guides the creation of case plan tailored to each youth's identified needs and strengths. The entire assessment and case planning process is informed by motivational interviewing and is designed to engage the youth, provide them with a sense of ownership over their own case plan, and match supervision and intervention strategies with the youth levels of risk and motivation. So how we incorporate this into practice is basically when one of those youth come in for a delinquency referral, is Tracy Erickson, our juvenile court intake worker, is sitting down with the youth and the family, and she's doing this pre-screen. The pre-screen consists of 33 questions, and basically it's at the end of doing the pre-screen, it comes up with whether the level of reoffense. So the level of reoffense for this youth, is that low, moderate, or high? Based on how the pre-screen comes back, we have the option to do a counsel and close. So which basically means we're talking to the youth, Tracy's talking to the youth in regards to what they did, how they got here, you know, what they could have done differently, connecting them with community resources, and then the case is closed. Or we can, sometimes we can refer back to law enforcement in regards to, and ask law enforcement to issue a citation. I just did that today in regards to a youth that was from St. Paul, Minnesota, but got arrested in Dunn County for possession of THC. And he referred it to juvenile intake. And it was like, okay, so instead of us going through this whole court process and this youth and the parents coming over from Minnesota, I referred that youth back to law enforcement for a citation. So that's an example of that. We can put them on a deferred prosecution agreement, which basically means that they are entering into an agreement to do A, B, C, D, and E, whatever it is. And if so, they sign this agreement. If they do those things, the case is closed. If they don't do those things or they get a new referral, we have the option of revoking the deferred prosecution and sending it over to court. And then they go to court for that original crime that they committed. And then the last option is a referral to the district attorney's office for a formal court petition, which is called a delinquency. So if the decision for the youth is to be, I gotta switch slides here. If the decision for the youth is to be opened for services, that's when we then go on and do what we call the full screen in the YAZI. So the full screen assessment is 88 questions, plus it's also taking those 33 questions that we did in the pre-screen. It's taking all of that into consideration. The full assessment, when you hit submit on that, it comes back in kind of this cool looking wheel, and we call it the feedback wheel. And it basically gives you the 3 high risk areas for this youth based on off of those 10 domains that I had talked about. So these are the 10 different domains. So legal history, family, school / community, peer, alcohol, drugs, mental health, violent aggression, attitudes, skills, employment / free time. So sometimes, just for example, sometimes a youth might come back as being high risk in alcohol, drugs, violence, aggression, and attitudes. But maybe, maybe the school doesn't show up as being high risk. But the other 3 are the high risk areas that we need to target. So we basically, then what this does is it comes back and it gives us these 3 domains. What did I write in here? And these domains shoot up as being, the areas that the social worker needs to target. The social worker then meets with the youth and with the family. And this is where the youth is really supposed to be engaged and hopefully engaged, but they're talking through these different areas, and the youth basically gets to decide where they want to start. So we try not to, tell them they got to do everything at once, but it's like you get to decide what area you want to start, where you want to focus your energy on. So, Oh, I think I just, yeah, kind of went through that whole thing. Basically, then a case plan is developed. So they take those 3 different targeted areas and they create goals underneath each one of those areas. We use a lot of carry guides with youth, which is basically a tool that we have purchased. And it just offers up a really nice, well, it provides education to the youth in regards to like a certain, maybe they had a struggle with a peer, maybe they're struggling with alcohol or drugs. So it's basically this packet of information. Part of it is education. So the social worker and the youth are sitting down, they're going through what they call this carry guide together. And then a lot of times there's homework at the end and there's an assignment. And they have to talk about what they learned. Some of the higher functioning youth can be handed an assignment and they're motivated and they'll complete it for the next time the social worker comes and meets with them. But a lot of the youth that we work with, I mean, they just, they have struggles. And so the social worker a lot of times is sitting down and they're doing all of those assignments together, but we typically, I would say old youth justice world was about consequences. If you didn't do something, you got consequenced. If you didn't do this, you got consequenced. The state has completely gone away from that. I can't even tell you the last time that we used secure detention. It's been years, and we used to do 72-hour holds in secure detention or a 24-hour hold in secure detention or a 72-hour hold at Positive Alternatives, the local group home. We don't do that anymore. For a one-night stay at Positive Alternatives is over $400. And I tell my workers, how can we incentivize this youth? What can we do? It's amazing what youth are willing to do for a Gatorade or some peanut M&Ms. I mean, amazing. I'm like, that's cost us $2, and they're willing to do so much and they're so happy to receive it. So, just think of all of the creative things that we could do and the incentives and rewards that we could provide for one night at Positive Alternatives. So it definitely is based on more rewards, more incentives, giving the youth some kudos, verbal praise. I mean, all of those things really, really do matter. So I was just meeting with one of my workers today in supervision, and one of the other things that you do with the Yazzie is you do a 6-month full assessment again. So you basically are fully assessing at 6 months. And she came in and so all of the workers have these nice little folders where they keep their feedback wheel and the case plan and the carry guides. They stick them in these things for each one of their youth. And she was like, he came in as high risk and he's low risk. She's like, he's been working so hard. He's been doing so many carry guides and it really shows. And so we had talked about, doing an early case closure as one of those incentives. I mean, because, do we need to continue to work with this youth if he really is at a point of being low risk now? So that was the next discussion that she was going to have with the youth and the family. But it just definitely has much more of a positive feel overall, I would say youth justice does, versus negative and punitive. So it's been really great. So that's what I have to share. Do you guys have any questions?
That's really interesting. I didn't know this.
Yeah.
So this is new information and it's helpful.
Well, and
Interesting.
It's just a lot. I think it's a lot more meaningful to basically have these guided discussions with the youth every time they're going to meet with the youth versus, how was this last month? Did you get in any trouble? Have you been good? Versus and just really having some something to work towards
Resources.
and some help in guiding some of those discussions and really targeting those different areas of need. On placements? Oh, well, that's, I would say, another big, huge kudos to my workers is our workers and really family and children's unit as a whole has a very big belief that youth and children are best served in their families and in their own communities. And the workers work very hard in regards to keeping these kids in their own communities. So they're very creative, very innovative. But I mean, it's probably been 3 years maybe since we've had a child in residential care. We had a young lady at a group home this past year for a couple months. It was just basically because she was placed with a relative and that placement failed with a relative, and we were having a difficult time finding her a foster home to go to. So she did go into group home for a couple months, but we haven't had any spendy placements. And I hate to say that out loud. It's like sometimes putting things out in the universe, We've been really, really great on, it's been great on being able to keep kids in their families or with a relative and in their own community.
Yes, please, Dr. Hall.
So thank you for this. It's really nice to learn about. So I have a few questions for you. One is, how long now has your department been working using this new model? And it sounds like the effects that you're seeing is this is much more effective in helping youth to improve and be able to function well. So how long has this been going, and are we seeing maybe it's too early to know, are we seeing lower rates of kind of reoffense and things
Yes.
like that? And then the second question, which is unrelated, but since you're here and you mentioned truancy court, and truancy is part of the youth justice system. So I hear grumblings and rumors that absenteeism is a big problem at Menominee High School. So I was just wondering if you could give us, some kind of a little, maybe you can't off the top of your head, but some kind of report card or benchmarking in terms of like, is this a big problem in our school district? Is this the same as it is everywhere? Just some information about that would be helpful.
So, okay, in answer to your first question in regards to the number of years, I would say it's probably been about 3 years. Not all of our staff started at that same time because a couple of my staff are newer. So not all of them have been up and consistently using the Yazzie, but that's been about 3 years. And it definitely has helped. I think it's changed, for one, it's changed the mindset of workers too, which then also has that trickle down effect. And the workers are definitely seeing more positive results using those rewards and incentives versus those heavy consequences. So our youth justice numbers are down. Our referrals for delinquency are down. And the reoffense rate is definitely down as well. What is not down is truancy. So our truancy numbers are basically through the roof. And I think when we come together we just had a meeting not that long ago with several people with the Menominee School District. Judge Meyer, who heads up our truancy court, our district attorney's office, and Tracy Erickson, our juvenile court intake worker, and myself. And it was just, I think a lot of the schools are really feeling that ever since COVID, kids really got out of the routine of having to go to school. So they weren't in school for a long time. And then when they did go back to school, it was like, they all learned that if you had a little sniffle or a little cough, I didn't have to go that day because, you can't go to school if you're sick. So then they're out, for a week, 10 days, not in school. And just this horrible kind of pattern started. And then they all have anxiety about having to go back to school. And then, so you hear a lot. I mean, there are just so many papers as of recent in regards to the mental health crisis with our kids and how schools and, human services need to work with those kids to try to slowly implement them back into the school district because their mental health is completely out of control. So that has definitely been an issue. And I don't even want to say it's not all students either. I think, some of it is definitely the parents. We're seeing some pretty high rates at the elementary level in regards to those children not getting to school. And we all know that that's not the child's issue. That's a parent's issue. So we are going to be trying a new thing with our truancy court. We're going to first implement it with the Menominee School District, and then we're going to kind of tweak it and hopefully work out any kinks and then open it up to the surrounding school districts. But we are going to be looking at, historically, we've only used truancy court for high school youth, the ones that are old enough to comprehend what's going on and are going to come into a court setting and have to report to a judge. But now we are bringing parents into truancy court, parents of those younger kids. So the children are not involved in truancy court. They're not invited to come to the court, but the parents are going to be summoned to the court. And they're basically going to have to report to the judge in regards to what they're doing as far as trying to get their kids to school. So we're hoping that works. And it's not going to be the answer. I don't really know what the answer is, but it'll be another tool that we can have in our tool bag as far as trying to combat truancy.
Ms. Barker.
From a school's perspective, because I deal, or at least I did, dealt with truancy a lot. And it's not like the schools go right to truancy. We don't.
No.
We try and work, and we have a system that we have to do. You have to have a meeting with the parent, you have to come up with a plan, you have to implement the plan, and we try everything. And it's not a majority of students, I wouldn't say, but there's a good handful. And a lot of times it is parent systems, even with the high school kids, because the parents are saying, I can't get them out of bed. I'm not going to force them out of bed. But we're seeing that trickling down lower and lower into the elementary area, where it is really frustrating when you've got a kiddo, and these are key times to learn, and they're not learning because they're home. But one thing I would wonder if we can also connect with the local clinics, because what we're seeing the parents doing is, oh, my kid's got a sniffle, I'm going into urgent care. And I get a doctor's note because they know the doctor's note is a get out of jail free kind of thing. Okay.
Get out of school.
Yeah, get out of school. I can get out of school. And they're doing it almost every day sometimes. And so they're seeing a new provider at the urgent care. And that provider, of course, is doing what they do. They look and they say, oh man, well, yeah, you've got an excuse for today. I know when I was up in Park Falls, because I was very involved with truancy up there, especially with the special ed population. And I actually had to call the clinic and I had to say, this kid has had 20 different excuses from 20 different times. Do you guys look back at your records and see that? And the response was, we never thought of that. So then they started doing that. And I hate to say that, but that's kind of a systematic issue. And if we can include something, apprise the, Mayo Health System, Prevea, whatever, They also skip, they go to Mayo once and then they'll go to Purveyor. And, you know, sometimes they hit Marshfield and, you know, I hate to say that, but that's what the schools are dealing with. And it gets really frustrating because we don't do anything. I mean, they have, it's supposed to be 5 a semester, but it can be 10 per year. We don't actually do anything until after they hit that 15, and that's a lot of days.
A lot of truancy.
You know, and when you've got families that are missing, well, we've got one family that it was 3 years almost of data of not being in school. It's real hard because we also want them to graduate. We want them to be productive citizens. You know, we want all that to happen. And it's real frustrating for us.
Yeah, understand. Carrie, do you have a response to that?
I definitely think that it is a systematic issue. And those ones that have been chronic, you know, at kind of shopping around for those different doctor's notes. I mean, yeah, we certainly have reached out in those cases to try to curb some of that, but
It's frustrating.
Yeah.
It is so frustrating.
Other questions? Yes, please, Supervisor Steen.
Well, this is an observation. I'm old, from the old school, and I spent 22 years in the school as a special education aide. And my observation is that on behavior situations, and I would say now a truancy, that you have to make, in my estimation, a kid misbehaves and then he sits in the office till the parents can come from work and get him. I don't know, that ain't the way it ought to be. It's your kid, come here and get him. Make it uncomfortable on the parent, and you'll get some results. Now, it doesn't take a brilliant kid to figure out that you can't charge them with disorderly conduct. You can, they don't have to pay the fine, and neither do the parents. So how long before these figure it out, I'm not gonna get punished? You know, I think one way is that, I mean, you had the kid, you raise him. We shouldn't have to raise them, teachers. Now, maybe that's an old fashioned way of looking at it, but, and I say, make it uncomfortable for the parent, make them get out of work. Cause if they gotta miss too much work, they'll straighten the kid out.
Some will.
Well, yeah, some is better than none.
Other questions or observations at this point?
Please.
Supervisor Breslin, please.
First of all, excellent presentation. Thank you. Early on, you mentioned a case where it involved someone from Minnesota, St. Paul. What would you say the percentage of our resources are going toward dealing with people that live outside the county?
thankfully, it does not happen often. It really doesn't. So there's been a couple situations over the years. I remember one that kind of got drug on, but a youth had stolen a car in Minnesota and then stolen another car in Wisconsin and got pulled over in Dunn County. That youth did go to secure detention. And basically it took quite a while for that whole thing to get worked out, but we did send a bill to Minnesota.
Yeah.
And did they pay?
Yes.
All right, yes, Supervisor Steen.
Just to prove that I'm not really an old grump.
Oh, yeah?
Yeah. Yeah, no. What I'm hearing, Carrie, is that, and I also thought this when I was working at the school, why don't you act like an adult? Why don't you act like an adult? We don't treat them like adults. You know what I'm saying? We don't. So if you want, what I'm understanding from you, Carrie, is that it's a collaborative thing along with the child.
Mhm.
You're involving them and making some decisions. You're treating them more or less like an adult because they're going to be responsible for the thing. And I think in schools, I've seen it, and you got to have a little more empathy, and you got to involve them. If it's always the heavy hand, what kind of result are you going to get?
As
But-
Carrie has indicated in this process. I
But,
mean,
and I worked with,
carrot works better than the stick.
yeah, sometimes you got to use a stick, but then maybe you should wear a glove when you're using a stick,
Supervisor Hagan.
I just have one point again. Yeah, this is a great program and I really love it. And I was gonna ask about how long it was going on for. 3 years is great. Part of that, you brought up the 10 domain circle.
Mhm.
I can visualize what it looks like in my head. And I was thinking with that, that seems like it'd be data that would be useful in finding any trends that may be happening over time in the county. Is there a process for that? Are people looking into that type of using that
Yes.
data for that?
Yes. So we have a child welfare reporting system called eWSACWIS. So all of our child protection and child welfare reports go in there as well and our youth justice information goes in there too. So I am able to run reports, what they're called. So you can run it on a monthly basis, on a 6-month basis, on a yearly basis, and you can run reports based on all of the data that the information or that the social workers are putting in to the system with Yazi. So yeah, it's been quite interesting.
It seems useful in that, like, let's say a lot of the reports of that circle are showing a lot of alcohol use by youth. You can see that maybe that's something the county needs to address, or if there's drug use and that's coinciding with a larger drug epidemic in the county or whatnot, that could be correlation there or something like that. Or maybe it's something completely different than what's happening in the rest of the county. So maybe one of those 10 issues is something that we can focus on and learn how to solve that issue.
Absolutely.
The program that you are going to pilot here in Menominee with the younger kids and
Mhm.
bringing the parents in. So are we then tying, because that's one of the things too, is sometimes parents don't know what to do.
Mhm.
And they seem to have no control over even 4-year-olds. Sorry, dealing with a parent
Mhm.
that's that way now. Well, I can't make them do anything type thing. I can't get them out of bed. So are we going to then link them into services that would give them and maybe like parenting classes, things
yep.
like that?
Yep.
Cause I think
the
they're gonna
same-
need support.
Same with the youth justice, same with these kids that are involved in youth justice. If family is one of those issues that's coming up on that, one of those top 10 domains that's contributing to the fact that they might reoffend if the family system is so unwell, we are definitely putting services in that family system to try to bring it from, a level here to a level up here to really increase those parents functioning so they can, learn some skills and hopefully provide better supervision and some better care to help the child.
Thank you. As you can tell from the level of discussion, that's very interesting and very helpful and well done. Thank you very much
You're
for being
welcome.
here. Thank you. We have a couple of action items to take care of. The first is our regular February DHS vouchers paid. Again, our checkbook. The amount for February was $904,279.46. I need a motion to note review of the February DHS vouchers. You absolutely may, and we thank you, Ms. Barker. Is there a second?
I'll second.
Thank you, Mr. Lamb. Any further discussion? If not, all in favor of noting the vouchers for February, say aye.
Aye.
Any
Aye.
opposed? Vouchers are noted, and we have a budget adjustment for human services. Pretty self-explanatory. One of them is a grant for $371,000. And the other is for coordinated specialty care, and there's some additional monies that didn't get put on in the budget when the grant was received. Pretty routine. I need a motion to approve the DHS budget adjustment. Dr. Hall, is there a second? Ms. Barker seconds. Any further discussion? If not, all in favor, say aye.
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 Opposed? Budget adjustment passes. And that, unless there are announcements. Absolutely.
I'll just share my screen really quickly so you guys can see. So there is a partnership with the Menominee School District, Health Done Right, and the Menominee Library to bring to you a screening of Ken Burns hiding in plain sight about youth mental health. You've heard a little bit about that today. On March 30th from 6:30 to 7:30. And again, there'll be the screening and then a panel after that. Okay.
Lovely. Thank you for that. And the supervisors will be otherwise engaged on Saturday, but Saturday is Stepping Stones Empty Bowls fundraiser, $10 for all the soup you can eat and bread and dessert, and it is for a really excellent cause. So go if you. It's at the,
Where is it?
I
It's the high
can't
school.
remember.
I
It's
think
at the high school.
school.
It's at the high school. So please go.
And I think there's a silent auction.
Yes, there are auction, lots of auction items. I asked if they would deliver soup and the answer was no. Thank you, everybody. And thank you particularly Bonnie for, again, for your service,
Hey.
and enjoy your partial retirement, sort of pseudo retirement.
3 days next year, maybe. Hopefully.
All right, and please, everybody, stay for a while and eat your